Mr. Guru. Hi.
Hello,
Welcome, sir.
How are
Namaste and
you?
Sat Shri Akal.
Namaste.
Our
Namaste. Good
talk show with
evening.
Dr. Saggu, and this is what we do every Saturday with Dr. Saggu. Today we talk about fatty liver and obesity. So, Dr. Saggu, stage is yours.
Yeah, thank you so much. Thank you, Kim, Ankit, and all of you, Jimmy. Thank you very much, Rakeshji. I think we have talked about a lot of things, and whenever we think that there is a problem with the liver, we always think about the alcohol. But I think now, along with that, this epidemic, you can say it is an epidemic. So two epidemics are going on alongside. One is the obesity, and along with that, the liver problem, or you can say the fatty liver. So this is a sort of epidemic, and we know very well that epidemic is an unusual occurrence of any disease in a community or in some part of the nation, or when the expected occurrences occurs in excess of that, so it is an epidemic, and it becomes pandemic when the same occurrence of the disease in excess occurs in large or widened geographic area, maybe some part of the nation, maybe subcontinent, continent, or all of the world. So, like the corona or COVID-19 pandemic is going on. So, on the same basis, these two epidemics they are going on side by side. That is obesity and we can say the fatty liver disease. So basically, the fatty liver disease when there is a deposition of the fat is there in the liver cells because we have small hepatocytes, and the function of the liver is number one, the liver detoxifies the body. Whatever the toxins are there in the body that is being detoxified or they are being excreted by the liver. Number two is there is some excretion of some medications. We can say the metabolism of some medications, some sort of the painkiller or some other antibiotic which we are taking. So they are being metabolized to the liver and being excreted. And number three is the synthesis of the bile juice that is helpful in digestion. And because of that, we can have a good digestion. So all three, the major function of the liver. When there is involvement of the liver cells, there are the hepatocytes, then they can check the normal function of the liver, and we then only we say that our liver is going into the failure. There are certain stages of the liver failure. So first we need to understand what are the causes that can damage your liver. Yes, alcohol is there, but now we can say that there are so many risk factors like obesity is there, diabetes is there, or high fatty food is there. So all these they are the risk factor for developing the fatty liver. So if there is a problem with because of the alcohol, we say always we say that it's an alcoholic liver disease. But when it is not because of the alcohol, we always say this is NAFLD, that is non-alcoholic fatty liver disease. In NAFLD, if there is a deposition of small droplets of the fat in the hepatocytes, that is NAFLD. The fat droplets are there in the liver cells. The further stage when these fat cells they grow inside the whole of the cytoplasm of the cell, then they pushes the nuclei of the hepatocyte on the one side, and then they can do the lysis of the cell. So the normal cells of the liver they are being damaged by the lysis of the cells. Then the inflammation starts occurring in the liver. So first stage is always a normal liver. From there, NAFLD, there is a deposition of small droplets. We can say the medical term is steatosis. So this is called as steatosis. And when there is in steatosis, when there is a lysis of the cells and some sort of inflammation is going on, then when this lysis starts healing, so whenever there is a wound on our body, so when the wound heals, it leaves some scar tissue there. So on the same procedure, when there is a healing of the area in the liver, it leaves scar there, and because of the scar, the fibrosis is there in the liver. So the normal cells they are being converted into the fibrosis. So we don't have a normal cell. The normal function of the liver cell is not there, but in spite of the liver cell, we have a fibrosis over there, and slowly, and this is known as steatohepatitis. So normal liver, NAFLD, that is a non-alcoholic fatty liver disease. When there is an inflammation because of the lysis of the cell, lot of free fatty acids or cytokines are being secreted, then it is known as steatohepatitis. And from steatohepatitis, some sort of fibrosis is occurring. And when the fibrosis goes into a higher extent, then it can lead to cirrhosis of the liver. So cirrhosis of the liver is the third stage. And then cirrhosis, after the cirrhosis of the liver, it can progress to the hepatocellular carcinoma, that is a cancer of the liver. So we have seen from the normal liver cell, we have reached up to the cancer of the liver, and the whole process which is going on in between is because of obesity. So we can say the obesity can complicate each and every part of each and every organ of your body. So that includes liver also. Whenever we have fat cells, whenever we have a fat in excess in our body, so that our body has tendency to store or deposit that fat in all the organs. When it is in the liver, it is fatty liver. When it is a spleen, it's a fatty spleen. When it is the omentum, it is a visceral fat. When it is subcutaneous tissue, it is the adipocyte or adipose tissues. So the fat is being deposited and gives us a gift of the obesity. So we have discussed about that. This obesity is a man-made obesity. Why this obesity is occurring? Why our fatty liver is occurring? Because of there is imbalance in the calories taken and between the calorie consumption or ingestion of high calorie food, ultra processed diet, high fatty foods, and low protein diet. So all these factors they can lead to fatty liver. So when we see why this deposition occur, because whenever there is an extra fat or extra calorie in the body, they are in the adipose tissue, and from the adipose tissue, there are basically triacylglycerol are there in the excess of the fat in the cells, and from there, from the fat cell, from the adipose tissue, from the peripheral organs, through the blood, they reach to the liver, and in the liver, they become triacylglycerol, and they are being deposited in the cell in the form of triacylglycerol. And the function of the liver is they oxidize these TACs into VLDL, that is the very low density lipoproteins. So they convert into the lipoproteins, and from there we can excrete all those TAGs, and we can excrete all those fat cells. So this is a normal function. The fat is going from the blood to the liver, and the liver can convert into the VLDL, and VLDL is going into the blood. So there is no storage of fat. When there is a prevention, or we can check of any process, whether it is oxidation of the fat in the liver is being prevented, or excretion of the VLDL, or the synthesis of the VLDL is being prevented, so we can have a fatty liver also. So instead of having obesity, other factors are also there. If we are taking some sort of medications which prevent the lipoprotein synthesis, they can also lead to fatty liver. Some essential amino acids are also there, like methionine is there, which is helpful in the synthesis of lipoprotein. If we are not taking enough of good essential fatty acids, then there is a prevention of the synthesis of deprivation of synthesis of the lipoprotein. So then the TAG is being not converted into the VLDL. So then the extra fat is deposited in the liver. So I'm not talking about only in the obesity, but yes, in the starvation also. During the starvation, we don't have a good amount of essential fatty acids or amino acids. They are responsible for excretion of the fat from the liver. Even then, we can have a fatty liver. In excess of the carbohydrate in the food, the extra carbohydrate being converted to the fat, and then it goes to the liver. Then again, it can lead to the fatty acid. So excess of the carbohydrate in the diet, less of the carbohydrate in the diet also can lead to fatty acids, because fatty liver, because if we don't take carbohydrate, then then the fats is also being converted to the carbohydrate, and the carbohydrate can again give rise to the fatty liver. So both things are not good. Even the starvation can lead to fatty liver, or the obesity can lead to fatty liver. But the prevalence of the fatty liver in the obese people is around 66%. If once BMI is more than 30, then he is 66 to 70% higher risk of having a fatty liver. Because of alcohol, around 45 to 50% chances are there that the patient is going to have a fatty liver. If we combine both, if the patient is obese, his or her BMI is more than 30, and he or she is also drinking alcohol in excess amount, then the chances of having a fatty liver is around 96 to 98%. So this combination, obesity with the alcoholism, is not good. On almost, you can say, 95 to 100% cases, the chances of fatty liver is there. So how we can prevent this? We can treat the obesity, and always we can be aware of the diet. We should be aware of the healthy lifestyle, and we should know that what constituents of the diet we should be having in the diet, so that the fatty liver should not develop. So if you have a fatty liver, then definitely first and foremost is you have to change your lifestyle, you have to change your constants of diet, you have to change your pattern of diet, you have to change all the etiquettes regarding your diet and your physical activities. And if your BMI is very high, you can say 35 to 40, then definitely bariatric surgery is there to help to decrease the chances of fatty liver. So what we have seen, according to the data presented and because of the RCT studies, we have seen uh, uh, because of 60% loss of your excess body weight, it will give rise to 85% chances to disappearance of steatosis, and 75% chances the disappearance of the fibrosis in the liver. So by the bariatric surgery, by losing weight, definitely there are chances that you can reverse the condition of your liver, and there will not be chances of going into the liver
Yes, sir.
transplantation.
Oh, right. So,
That was interesting talk about liver and
you know, we got to be careful, right? Eat right, get our livers.
for joining
Thank
us.
you so much.